And tonight, Arizona's largest hospital system could limit non-urgent surgeries to preserve hospital space and resources. We're talking about Banner hospitals. A spokesperson says they're still going to perform medically necessary surgeries or procedures. Let's get over to David Caltabiano. Elective operations are under a microscope, David, and you're here to explain the difference between these non-urgent and these elective surgeries.
Yet a Banner hospital spokesperson used the example as a hip replacement as a procedure that could put off that procedure. The spokesperson says that surgeons will make the final decision to halt such operations on a case-by-case basis. This decision follows other hospitals that are looking at the same option. Tonight, the coronavirus pandemic is stretching hospital systems thin yet again. Now, Banner Health announced that they may limit non-urgent surgeries that would require hospitalization.
The concern is, what is our resource capability, and that we have to prioritize urgency. We have to do what's necessary, and that's triaging importance.
Dr. Ross Goldberg is the vice chair of surgery for Valleywise Health. He says his hospital system is keeping a close eye on capacity to see if they too will have to halt non-urgent or elective surgeries.
And we really try to determine day by day what we can and can't do. I can't tell you what's going to happen tomorrow. It all depends on our numbers and all depends on what we have on the books.
A spokesperson for Banner Health says that medical professionals will have to decide on a case-by-case basis which non-urgent surgery will have to be put off. Dr. Goldberg says it's a tough position to be in.
No one wants to tell a patient, especially if you set them up, got them ready, talked to them about an operation, and are now telling them, look, we have to delay things. That's unfair for the patient. I feel horrible when you have to tell a patient that. There are things that are outside your control, but you have to do also an examination of what's for the greater good.
The greater good, Dr. Goldberg says, boils down to the vaccine. He says many patients taking up beds are unvaccinated. Medical professionals, himself included, are pleading yet again to roll up your sleeve, which he believes will alleviate the capacity issues doctors are seeing today.
The healthcare community as a whole are tired. This has been going on close to 2 years. We are concerned that we will burn through people. This is when we have to be a community and work together.
And tonight we reached out to other Valley hospitals about elective surgeries. Abrazo is not delaying them. Meanwhile, Mayo Clinic told us they're looking at procedures that can be delayed safely. Yetta.